Meanwhile, more testing for COVID-19 started today. Private labs are stepping in, and the state is kicking into high gear to look for potential cases spread in the community.
Tonight, there are growing complaints from people with flu-like symptoms who don't have the flu but are demanding a coronavirus test. Mahea Richardson joins us with more. Mahea.
Well, here's what we know. There are 2 confirmed cases of COVID-19. State health officials say both are cases of Oahu residents who traveled from out of state. But now there will be more testing to look for the virus and see if it's spreading within the community.
The Department of Health will be conducting 200 COVID-19 tests each week from people whose first test came back negative for influenza. The tests will be random tests of 400 samples.
This new Sentinel community surveillance program will allow the state to proactively identify potential cases of community spread of COVID-19.
The state lab has capacity to do 250 COVID-19 tests per week, but with stringent CDC guidelines, so far has only conducted 22 tests, with 2 testing positive. The state says COVID-19 tests need to be reserved for the critically ill.
It wouldn't make sense that we use our State Department of Health capacity just to test anyone who is interested in getting a test.
That doesn't sit well with a growing number of sick patients. A 50-year-old Honolulu woman told Hawaii News Now she's battling flu-like symptoms with a fever and has a compromised immune system. She says she has not been tested for COVID-19, even though she went to an urgent care and then an ER and tested negative for flu.
It shouldn't take an act of Congress for me to get a COVID-19 test to put everybody's mind at ease.
I heard a lot of people complaining, and I know they're working really hard at DOH. I mean, really tracking down all sorts of cases, but they've always been understaffed.
The lieutenant governor says private lab testing started today at Clinical Labs Hawaii. Then will come diagnostic labs. Kaiser says it'll be ready in 2 weeks. State officials say the private testing will help the state and still needs to be ordered by physicians to the health department.
They're being very conservative, and we're trying to hold back some tests in case we had a surge of very sick people. But I definitely think we should have tested more, and we have to test more, and that's why we fought hard to get Clinical Labs of Hawaii up and testing. So they're testing as of today.
Also today, there is drive-through testing for COVID-19. That's being offered by Urgent Care Hawaii on Oahu. The samples will be sent to Clinical Labs, which says turnaround time for those results is about 3 days. Mahea Richardson, Hawaii News Now.